All right, everybody. Well, welcome. This is our third town hall in a series of 4 town halls this week, discussing the safety guidelines and protocols that are being put into place as students return to campus. This one is about winter sports, which are my 5 favorite teams at Gettysburg. Why? Because it doesn't rain or snow indoors, although sometimes the lights do go off in the middle of a race. That's an inside joke for the swim team. So, if you have any questions throughout today's presentation, you can send them to me. My name is Corey Jewett. I'm the Director of Athletic Communications here at Gettysburg. I'm headed into my 14th year here. If you can just send me those questions directly in the chat, that should be at the top or bottom of your screen, and we will get to those at the end of the presentation. We got a lot to cover tonight. So we want to make sure that our presenters have enough time to go over everything. Believe me, it's a very detailed presentation, so there might be some questions that are answered over the next 40 to 50 minutes. So at the end of the presentation, if there's something that wasn't answered, please send that question my way and we'll be sure to try to answer that. Also, please make sure you are muted during the presentation as well. We don't want the video to accidentally flip to you in the middle and then you'll be front and center. So before we get to our presenters, I just want to toss out a couple helpful websites. The one, of course, is the Gettysburg College website, Better Together. You see the link there. That has all the information regarding move-in, academic schedules, dining services, everything related to the current situation that can all be found on the Better Together website. There should also be an updated town hall. I believe there's a town hall this afternoon, a second one for parents. So hopefully there were some more questions answered as well. I'm not sure if that is updated on the website, but it should be soon. We, as a department, athletics department, have our own COVID fact page as well. There are a number of resources on that page, such as information regarding the Jaeger Center, the equipment room, some of the things you'll see in tonight's presentation. That, just like the college page, is updated every single day. You can also see some of the latest videos we've churned out. Tonight's town hall will also be posted there later tonight. Of course, the NCAA resource page is there as well. A lot of helpful information from the NCAA regarding COVID-19. So without further ado, we're going to go right to the presentation. And we have Mike Mattia kicking things off. Mike is the Executive Director of Intercollegiate Athletics and Campus Recreation and is entering his 3rd year at Gettysburg. Mike, take it away.
Thanks, Corey. Appreciate it, and appreciate everybody taking the time to be on this presentation today. Just want to let you know, especially the student athletes, know that we're extremely excited that you're all going to be returning to campus in the very, very near future. Our campus has been too quiet for too long, and we're looking forward to that shot of energy that you all bring when you return to campus. And we're going to do our best to make it the safest, healthiest, and best environment we possibly can, considering all that is going on. I understand the uncertainty that you all have been going through during this very difficult time. I know we have a group here, especially our swimmers. We had a number of swimmers who this past March were scheduled to participate in the NCAA championships, and that was canceled right before they were supposed to head on out. And now they're dealing with this second time around. So I apologize for that. And I know how difficult this may be. And our goal tonight is to provide as much information and hopefully fill in some of the questions that you may have. So initially, I want to get started just to let you know what the decision-making process is that led us to where we are. And then I have a few other things to discuss. So per the bylaws of the Centennial Conference, which is now over 30 years old, the Centennial Conference presidents are the final decision makers in everything all conference related. Right after the 4th of July, the announcement came out of suspending all sports, the fall and winter start of winter for the fall semester, with going to look at it again later on in September. What went into that was information from the Centennial Conference ADs. We met all the time, and I can tell you that I had great interaction with our president, President Giuliano, during this time. He was very engaged, asking many questions, and really supportive and wanting to provide as much of an athletic experience as we possibly can provide. There was also a Centennial Conference Advisory Group that was created, made up of many different areas of the campus from all the different campuses. And we had our very own Mike Cantelli, our head athletic trainer, who you'll be hearing from later on in this presentation, as well as our own team doctor, Dr. Lavalle, who are part of this group. And this group is continuing to meet as well to help advise the presidents as we move forward to the next stage of decision making. We also had Dr. Adalja. Now, he is a doctor from Johns Hopkins University Public Health, and many of you may have seen him with some spots during this time of COVID on CNN, and he's also written a number of op-eds in the Washington Post, and he's a member of the NCAA advisory group that's been advising the NCAA with all of their decision-making process, starting back in March during this time of COVID. And he's done a phenomenal job and made himself available specifically to our conference and the presidents to ask a lot of questions there. Obviously, the health and safety was #1 priority for the decisions that have been made for the student athletes, coaches, staff, campus, and our whole surrounding community, not just of Gettysburg, but of all 11 member institutions in the Centennial Conference. Another concern also had to do with travel and us traveling to another campus and then coming back onto our campus, and other schools coming to our campus. That had an issue. Those that you have been on some of the town halls and have been reading the material from the institution know that there's going to be a strict travel policy, not just from athletics, but for the whole campus. And we're looking really to keep our unit here intact and not have too many people traveling in and out of campus here. So as I mentioned, the next decision can come from the presidents at this moment. It's scheduled for the end of September, and the progress of the virus on our campus and all the other campuses in the region, that's going to tie in our ability to get started with our winter seasons and when that will take place. Now, I know throughout from the time that we made that decision to present day that the many Centennial schools who were originally planning on coming back in a full capacity like Gettysburg is have either gone fully remote or only bringing back a certain number of students, which essentially prohibits them from any possibility of competing. And at this point, there are only 5 Centennial schools that are bringing back all of their students that they can on campus. I know this puts into question, well, how are we going to be able to start a fall semester with only 5 Centennial schools even available at this point? I do know that the Centennial Conference presidents meet next week. Presently, this is not on their agenda to discuss, but it could be added, especially with the fact that the NCAA came out and canceled the fall championships for Division III and Division II for that matter today. We will continue to keep everybody updated with any new information that comes to light in regards to when a possible start date for the winter seasons will be. Great, go on to the next one, please. So I just want to talk about where we're at specifically with Gettysburg right now. This all started back in May. An athletic subcommittee was put together, made up of athletic administrators, coaches, our faculty athletic rep was on it, sports medicine, members from the strength and conditioning staff, our equipment manager was on there. So we had that group set up, and that was intended, along with many groups throughout the entire campus, to make recommendations to our president, which ultimately made recommendations to our board of trustees of whether or not we felt that our campus could return and open as a fully residential institution. Our recommendation from an athletic perspective at that time was, yes, we felt we could provide some level of athletic activity in a safe and healthy way if all of our students came back to campus. And ultimately, as you know, the Gettysburg decided that they are going to bring as many students back as want to and are able to come back. What that did was trigger us to move to an athletic action team, and they were an implementation team. Many of the same members who were on our recommendation team were added to the action team, as well as we had additional 4 student athletes became part of that group as well. During this time, we also had the great pleasure of having Keeling & Associates, a third-party consulting group that's done a phenomenal job helping us and specifically for athletics, we've had Suzanne Kofi, who actually is on the call and can step in and help us if we need to answer any questions today. But she's done a phenomenal job of providing great insight for us, a great sounding board, and really helping us along this process. Before she got into the consulting world, she was an AD for many years in the NESCAC, and again, has provided some great information. Obviously, we've been looking at the CDC, state, local, NCAA, and Centennial Conference recommendations as we've put everything together. And our coaches, our staff, everybody who took part in inputting into these plans put a lot of thought and hard work in, and I want to thank them for the effort that they put forth. It's just been tireless during this time, and I think we've got a great plan in place. So what are the expectations now when you return to campus? Well, you're still going to be able to engage with your coaches and teammates. We're still going to be able to have some form of organized activity. It's going to be in a phased-in approach with small groups and be very sport-specific as you move through those phased-in approaches. And you'll hear some very specific details with that later on tonight in that presentation. It's imperative that everyone follows, from the student athletes to the coaching staff, and the staff members follow all the new policies and procedures, both from an athletic perspective and everything that the campus has put in. You'll hear from your coaches later on what the sport-specific things that you're going to be doing. What you're going to hear tonight is the general for all of our student athletes, and most of the sport-specific plans that are put in place are based off of what you're going to hear tonight. I know those of you that are returning to campus to sign the campus-wide student health pledge. You're going to be also getting the student athlete pledge coming to you along with the NCAA paperwork. Those of you who are returners know that it typically comes out in July. It's coming out now. So we ask you, when you get that information, to fill out the pledge as along with the NCAA paperwork. Please read the pledge. Any questions with it, let us know, and we'll be happy to talk to you about that. Also, as Corey mentioned, if you go to our COVID fact page, you can look at a lot of educational videos that we've already done, more on the general sense of what a day in the life of a student athlete might look like. In addition, we're going to be having some specific videos coming out in the near future about what just in the training room may look like, what your equipment room may look like, what your interaction in the Jaeger Center may look like. So be on the lookout and keep checking that website for those updates. Now, from an NCAA perspective, they've been reacting to what schools are doing. Some people have said that they've been very slow to come out with things. Well, it's taken a while for, at least in the Division III, for all of the conferences to make a decision as to what their conferences are doing. At this moment, 43 of the 44 conferences have either suspended or have canceled play in the fall, both fall sports and the start of winter sports. There is one conference that is out there that's at this moment going to give it a go, and we'll see how they do, and I think they'll be a good test case for us moving forward. And obviously that's kind of what led to the canceling of the Division III championships, where there just wasn't enough people to fully participate fall championships from a national title perspective. As you've heard, hopefully that if it's come out, there's eligibility, a blanket eligibility waiver by Division III that says if you compete in 50% of competitions, regardless of when those competitions take place during this academic year, that you will be able, 50% or less, you will be able to get a blanket waiver and get that year of eligibility back. And I just asked, I've spoken with many individually, spoken with many coaches, answering a lot of eligibility questions. I ask that if you do still continue to have eligibility questions, that you reach out to your individual coach and we'll get in touch with me and we'll go through that. Because each person has their own set of particular circumstances based off of where they're at in terms of trying to graduate and number of semesters that they've taken part in. So we really need to deal with those on an individual basis. Just last week, it came out that the NCAA has approved the removal of non-traditional and traditional seasons. It doesn't really apply to this group because you've always just had one season for the winter sports. But what is important is the 114 days. So we're going to be able to participate in our sports. Any athletic related activity is going to count as a day, and each sport will get 114 days to get their competitions and practices in. The other change for the winter sports, at least for wrestling and women's basketball, is the start date now has been moved to October 1st. Whether or not we actually get to that start date from a practice perspective, we shall see, but that will, as you'll hear later on from the strength and conditioning and some of these plans that we have in place that are really kick in, and the phasing period will start then. And again, we'll get to more details with that later on. And as I mentioned, with the NCAA championships fall for Division III have been canceled. In that release, the NCAA has still said that they are committed to doing everything they can to, as long as it is safe and healthy, to provide the championships for the winter and spring, specifically for this academic year, knowing that they were negatively affected and the first ones that was impacted last spring. As everything during this 5-month period, all of these plans are fluid and are subject to change. We just ask that you are patient and flexible with us. Let us know as we're going through these phases, what's working, what's not. We want to hear from you. We will definitely make the adjustments that we need to. I'm sure you're sick of hearing this already, but I'm going to reiterate that this is not going to be a normal semester. When you come on campus next week, you're going to see there's a lot of changes put in place specifically for the physical distancing, a lot of signs. You'll see people wearing their masks all the time. Our ability to move through these phases that you're about to hear about is ultimately going to be determined by the student athletes. Our president has mentioned to me many, many times that he expects our student athletes and our athletic coaches and staff to be leaders on this campus and help change the culture when it comes to following these new policies in place. We want to be the example of how the new way of managing through these COVID-related mitigation practices will be on our campus. Came across my desk just a couple minutes ago before we got on a press release about University of Louisville and how they've suspended about 4 or 5 of their teams because they had 28 positive tests that just came back. That all got traced back to a party. We all heard in beginning of the summer with some of the Division I football and basketball teams out there coming up with some positive tests, people going out to bars or being at parties. Really going to be asking you, our ability to get the winter season started are all going to be determined on whether or not we can follow these plans in place. And not just the season's getting started, but also being able to maintain as a residential academic institution, being able to have yourself taking classes in person rather than at home and online. So I will stop there, let the other presenters provide some great information for you, and I look forward to answering some questions later on.
Thanks, Mike. And as you mentioned, we do have a lot of cool stuff on our COVID fact page for everyone to check out. A lot of information there. But the best part is there's a great video. I got to give a shout out to Suki from the basketball team. We spent 2 days together making the video, kind of going around campus, exploring the new changes in the equipment room, the athletic training room, some of the flow through the building as well. So shout out to Suki for helping us out with that video. You can check it out on YouTube and as well as our COVID fact page. So thanks to Suki for that. So next up, we have Mike Cantelli, 1988 grad of Gettysburg. He's the Director of Athletic Medicine and Sports Performance, and he is over 3 decades here with the Orange and Blue. Take it away, Mike.
Thanks, Corey. Hello, everybody. Returners, we're excited to get you back. First years, transfers, welcome to the Bullet family. We're excited to get you on campus here and get going. I am just going to, first of all, just talk about some paperwork. Returners know we've gone through this every year. So a lot of paperwork that needs to be done. As athletic trainers, we have a standard of care that's pretty high. Through all of this and any speaker that you hear, your health and wellness is our #1 priority, both physical and behavioral health. So everything that we're doing and putting together has that at the top of our list of why we're doing this. So know that going into this. So first of all, hopefully all of you that have done all this, I thank you very much. If you haven't done it, please get it done today, tomorrow, as soon as possible. We are going through this right now as a staff. So all first years, juniors, and transfers, you need a physical from your home physician and should be uploaded to your Medicat portal. You should all be familiar with Medicat and how to do all that. You really need to be familiar with Medicat because all our COVID information and forms are going to be on that. So if you're not familiar, get on there, explore, and learn how to do that. So that should already be in first years, juniors, and transfers. Also, all first years, juniors, and transfers should have received instructions for the impact concussion baseline test. We added juniors this year because of some NCAA requirements. So again, all first year, juniors, and transfers have to take the impact concussion baseline test. If you are like, where I've not heard that, search your email. For about 3 weeks ago, Susan Fumagalli Mahoney sent you emails. So that name, Susan Fumagalli Mahoney, search her name and there should be directions in there on how to do that. Do not skip, you'll see in red in the directions, do not skip the demographics section or your results. We will not be able to see your results, so please do that. Also on your student center now will be sickle cell documentation. That is, you'll see, you can do either two things with that. You can, after reading the education that we provided there about sickle cell, again, this is an NCAA mandate, make sure you can either waive knowing your results or your status for sickle cell, or you need your physician to either write you a script to get a blood work, or most of us have had this test done at birth, so you can request that from your doctor and that gets sent to me. So one or the other, either get the test results to me or waive the test or waive the results, and either one is great. One of the last things that every student athlete on here needs to be doing is their health history. Again, this is in your student center. And what that does, it's kind of an update so we know what's going on with your health history since your last physical or the last time you were cleared to participate in athletics at Gettysburg. So everybody needs to do that part on your student center. Also, one thing that everybody needs to be doing, and this is from the college, on back to Medicat, you should go to forms and required forms, and there's a pre-arrival form that you needed to be filled out. Hopefully you've all done that, and it just wants to know your status, what you've been doing the last couple of weeks, so that we have a better idea how you're coming to campus. If you have or you do test positive before you come to campus, please let myself or someone in the health center know as soon as possible. Okay, if you have tested positive for COVID or you do test positive before you come for some reason, please let us know before coming to campus because we're getting pretty close. Also with this, you guys, we're within the 14 days of everybody's arrival. So assuming you've read that college policy that they're asking everybody to self-quarantine for 14 days before your arrival. So hopefully you're doing that now. You're not going out to party. You should have never been doing that anyhow, but you're not going out. You're staying away from large groups. You're staying at home as much as possible. You're wearing that mask. You're being great citizens and ready to come back to campus all healthy and ready to roll. So just want to real quick about some changes in the athletic training room. If you watch that video, Suki and I were stars of that video. So with Coach Dunn and some other people in there. So we have gone to appointment. The big thing is we've gone to appointment only, and you can sign up on your Medicat portal. And we will be starting those appointments next week, I guess, on the 10th, when people start coming back for testing, and then you go into a little self quarantine. We will be available. Sign up if you just want to chat for behavioral health issues. If you have some physical injury going on, we can walk you through. They're all going to be telemedicine appointments. So feel free to go on Medicat and sign up for that. Know that pre and post practice, there's not going to be those treatments, not going to be the hot tub, not going to be the ice baths, the hot packs, the hanging out, stretching, all that fun stuff that the athletic training room is all about. That safe zone, we're going to have to decrease that a little bit just to minimize our contacts with people and maintain that physical distancing. So if you are familiar, or if you want foam rollers or massage sticks, stretch bands, you're going to have to bring those yourself. And Kelly or somebody later will talk about a team shop that you'll be able to order some of those if you do not have those. But please understand that those will not be available for use for you when you get back. Okay. Another big thing for everyone, we will not be providing water bottles, or I guess with all you guys, we don't provide on-field water, but we will have water jugs in the gyms for you. But know that you need your ticket to get into practice or to a strength and conditioning session will be your own water bottle with your name on it, and it has to be filled to come to all those, okay? And there's also going to be another ticket that you're going to have to do to get into practices and to all your strength and conditioning. Every day, you're going to have to fill out a symptom checking on Medicat. And once you go through and you say, no, I'm all healthy, I don't have any of these symptoms, what will appear in your Medicat, you'll have a green dot that you'll be able to show people on your phone. So you come into your strength and conditioning with, say, Coach Hoyt, and you'll say, yeah, I did this. Here's my full water bottle. Let's get after it in the strength and conditioning program. All right, cool. Okay, so the next thing I want to talk about are our approach to getting back into practices. Okay, it's going to be a little different for you guys as winter athletes, but just know once we get to your practice start times, we will be going through these phases, and our idea is to start slow and make sure we're handling everything well, and then work up into a close to full practice as we can. Understand that not every team is going to be in the same phase at the same time. Just because on this call, right, swimming is just because of the nature of the sport and the numbers and the physical distancing that's already built into that sport is going to be a little easier to control than a basketball team or a wrestling team for sure. So don't compare. Just know we're going to guidance from our team physician, our staff, Mike Mattia, the coaching staff. We're all going to work together to see when it's safe and best to get through these phases. So the introductory phase will be kind of when we get back. We are doing the medical clearances. You'll be doing virtual meetings with your coaches, probably some working out on your own. And then phase one will be small group work where we get into no more than 10 individuals working out at one time. Phase two, we're going to up that number to a larger number, 25 or so. We'll start sharing some equipment, start to get in more organized, start using a basketball a little bit, whatever is appropriate for your sport. And then phase three, we'll start adding some contact drills for the basketballs and the wrestlings and types of things. And then phase four, we will get back to as much normal practice and competition as possible. That's our goal. All right. So some of you are probably asking, well, there's no time frame. How long am I in phase one, phase two, phase three? Well, we did that on purpose for a lot of reasons. We are going to be working with everyone I said, our team physician, our athletic training staff, coaching staff, our athletic director. Plus, we'll be working with Keeling and Associates, and then our campus community. How are we doing? How are we handling spread? Are we all healthy, doing well? How is Adams County doing, where we are located? How's the state of Pennsylvania doing, and how are we doing nationally with all this? All those will be factors in how fast we move through these phases, okay? So again, it's gonna be slow, it's gonna be methodical. Again, the number one priority is your health and safety and your well-being. Okay, so down at the bottom of this is culture change. You heard Mike Mattia talk about this. I'm going to try to reiterate it quick because, you know, I've been around here for a few years, and I know that our staff, our professional staff, and all our student athletes throughout the years have been leaders of this campus. And I know all of you that are on this call are leaders of our campus, and we really have to show it. Okay, when you guys are at practice, when you're with your coaches, you're in the athletic training room, equipment room, we know you guys are going to be doing the right thing. We're going to be doing the right thing. It's going to be, what's going to be hard, right, is Friday nights, Saturday nights, when your buddies are going to say, hey, let's go to this group someplace or do something. You're going to have to say, you know what, swimming or basketball or wrestling or whatever you're doing is a little more important, and you really shouldn't be having that get together, that gathering anyhow. So we're not going. We really don't want you guys to have it because we want to participate in athletics and stay on campus for the entire semester. So I know you guys can speak up, be the leaders. We're doing it as a staff, and we just ask you guys to help us for the rest of campus because I'm excited. We started today, you guys, it's coming quick. We started today. Our whole staff started the testing today. You can talk to Suki. He was in our group today. So he went through that, not a big deal, but we started, we're ready for you guys to come back, and we're excited. And you can, if you want to follow what athletic training, you can look on Instagram and follow us and see how we were all ready and how we were testing today. But we're excited, and I'll be ready at the end for any questions that you have for me. All right, thanks, guys.
Thanks, Mike. Nice plug for the athletic training Instagram account too. That was very well played.
Trying to get our numbers up to get up.
Again, that's a great way to follow the athletic training. And of course, you can follow the Gettysburg Athletics Instagram account too for some latest news as well. Moving on in our presentation, we have our third Mike of the hour. It is Mike Hoyt, our head strength and conditioning coach and assistant football coach. Mike Hoyt is entering his third full year at Gettysburg. You're on.
Thank you, Corey. Appreciate it. Welcome, everyone. Student athletes, it's great to see you. Parents, welcome. Thank you for being here this evening. I'm going to spend a few minutes talking strength and conditioning. I'll try to be as brief as I can, but there are some important things that we want to cover. The first thing I want to talk about is our training spaces. There'll be a lot of changes there. One of the first things that you will notice is our weight room as we typically knew it is going to look a lot different. We've taken all the free weight equipment, all the strength training equipment, and moved it to Hauser Fieldhouse. So if you can envision the area down where the big garage door was, that end of the field house is now going to be set up with all of our racks, platforms, dumbbells, plyo boxes. All the free weight area down below has now been moved into there. And the great thing about that is it's an athlete-only facility now. The second area that we have is going to be out in Musselman Stadium. There's going to be weight bars and bumper plates where we can do some Olympic-style training and other free weight exercises. We'll also have a second training area out in the stadium, which will have more what I call non-traditional equipment. There will be big tires. There will be some slosh pipes, some Bulgarian sandbags and things of that nature. If anybody has ever seen or participated in strongman training, there will be a lot of those types of exercises there. We have Clark Field that we've typically used a lot for spark training in the past. We still obviously have that space at our disposal, and we have plenty of grass fields as well. One thing you'll notice, most of these areas are outdoors. We're trying to get as much of our strength and conditioning stuff done outdoors, which obviously by CDC guidelines and things of that nature is highly recommended. Some of the guidelines that we need to be aware of as we get rolling here. The first thing is these spaces will be reserved through myself. So what will happen is your coaches will reserve times for you to be in these areas and use these areas. It's not that it's just open all day long for our student athletes to go in there randomly. We want to make sure we're in our groups, and we'll talk more about that in just a second. But those spaces will be reserved, and it'll be done based on your class schedule to ensure that you can get in there and get some training done. And then the second bullet point there, your training programs will be on file so that we can ensure that you are following acclimatization guidelines, which I'm going to talk more about in just a second. The third bullet point I have here, this is going to be big, and we've talked about culture change. Both Mikes have talked about that. And this is, we're creatures of habits, and we have our own ways of traveling through the athletic facilities. And basically, what we're trying to do is the building will follow a west to east flow. So you'll be coming in the building by the fitness center, and you will travel towards the east. We're trying to eliminate as much two-way traffic. We've got a lot of narrow hallways in there. So we're going to ask you to follow the traffic patterns that are established. You're going to see clearly marked signs that will direct you how to travel through the building and get to Hauser Fieldhouse, get to the training room and the equipment rooms and stuff like that. So it's really important that you be paying attention to that. The last thing here on this slide is our training sessions. They will be 60 and 90-minute blocks. And the important thing here is at the end of these training blocks, we're going to have 10 to 15 minutes at the end for sanitation. In these spaces, we're going to have multiple sanitation stations where there will be spray bottles with disinfectant. There will be wipes so that you can clean your training area. You will be using your own space, so you won't be sharing a bar, you won't be sharing dumbbells. You'll be using your own bar and your own equipment for that training session. So at the end, it's real easy for you to sanitize that, and then it's ready for the next group. Couple things in terms of participation in these strength and conditioning workouts. The first thing is temperature check. So when you show up to your training area, the coach that's in charge of your training group will take your temperature to make sure you're good to go from that standpoint. You heard Mike Cantelli talk about the daily symptom survey. So you'll be, make sure you're up to date on that. You'll have to show the coach in charge your phone with the green light there. And then the third thing is a water bottle that's filled up with water and ready to go. And you heard Mike Cantelli talk about that. So in order to get into your workout, we need to make sure that those three things are done every single time. Our physical distancing, when we're in our training groups, we want to maintain a 6-foot distance and 10 feet when we're exercising. The activities that we plan as a strength and conditioning staff will be sure to promote this. In addition to that, the equipment that we're moving into Hauser, that will be spaced a minimum of 10 feet, so you can be ensured that you're going to be distanced enough while you're exercising. The areas that we're setting up in the outdoor space, they'll be the same thing. It'll be distanced. The equipment will be set that far apart so you can be sure that you're far enough apart during your workouts. Our third bullet point here, you will be wearing your own clothing for workouts. Initially, as we get going here, and you'll hear Kelly talk about this, but we are not going to be doing laundry. We're not going to be issuing loops and stuff like that. This initial phase, as we get going, you're going to be wearing your own workout clothing. So be aware of that. Spotting is going to have to change. We're going to have to be aware of proper spotting technique so that we are not encouraging personal contact. Obviously, in the past, when we've spotted on exercises such as the squat and things of that nature, or exercises of that nature, personal contact happens. We're going to change the way we are spotting exercises. So we're going to have spotters on either end of the bar so that there is no personal contact, and we can still be safe, but we're eliminating that opportunity of contacting each other. We got to be training in the same group each time. So coaches will be setting you up in groups based on your class schedules and things of that nature, and you must train with the same group of athletes every single time. We don't want crossover of athletes from group to group because that's an opportunity for cross-contamination, and obviously we don't want that to occur. The same thing goes for the coaches. We're going to be assigning coaches to work with certain groups of athletes, and those will be the groups that they're assigned to and we'll be working with time after time. So you won't have one coach working with your group one day and the next day it's a different coach. We want to make sure that there's no crossover in that regard. We talked already about the training area and disinfecting after each training session. We're going to encourage you to wash your hands and sanitize them before you enter the training area, and then during the workout as well. And then obviously when you leave the workout, we want to make sure that you're sanitizing your hands. Again, that's going to be big, keeping you guys safe. Masks are going to be worn by athletes and coaches at all times during the workouts. The next bullet point, I want to be clear on this. We won't have any chalk available, and we don't want you to bring your own chalk. I know, for grip, especially when weights get heavy and you're sweating, a lot of you like to use chalk to help your grip, but that is a breeding ground for the virus. It's hard to keep things sanitized if we're using chalk. So our recommendation, my encouragement to you is to get yourself a good pair of workout gloves. I believe they're on the Team Shop. If you don't get them off the Team Shop, you can find workout gloves on Amazon and obviously, Dick's Sporting Goods and places like that. So if you're a person that likes to use chalk during your free weight workouts, really work on that before we get back up and running here. Group size, I'm going to kind of gloss over this. Mike Cantelli already talked about this, so we can get right into the next part here, the acclimatization period. So you heard Mike Cantelli talk about testing and screening, so I'll skip over that. But what we want to do is obviously a phased-in approach in terms of group size, but we want to phase you back into training. Obviously, you guys have been training over the summer. You have had your year-round training programs in place and your summer programs, but we can't be sure that everybody's had access to equipment and been training the way that they need to in a normal situation. So we're going to take a 4-week period and make sure that we phase you back into athletic activity. There's going to be a decrease in volume, decrease in intensity, or both. We're going to start off with a 50% reduction, then we'll move to a 30% reduction, progress to a 20% reduction, and then 20% reduction before we get into full 100% full go. Our work rest ratios starting out are going to be at 1 to 4. So for example, if the exercise takes 10 seconds, we're going to be looking at a 40-second rest period. If it's a 1-minute exercise, we're going to go to a 4-minute rest period. So be aware of that. And we'll obviously continue to follow the FIT principle, but frequency, intensity, and volume, obviously initially those are going to be reduced. So again, we can phase you back in, ease you back into your training. Couple other things that to be aware of: dynamic warm-up, which we always do before each training session. Obviously, that's going to be used to prepare your body for the activity that you're about to do and everything like that. But we're going to also encourage coaches to start to reestablish sport-related movement patterns. It's been a while since you have been in any sport-related activity. So in order to make sure that we're reducing injury, things like that, we're going to use that as a time to get you back into that, as well as introduce prehab exercises. Again, this is going to be very sport specific. We've also got to pay attention to environmental factors, the fact that we will be training outside a lot. We got to be aware of heat and humidity. So we're going to try to do a lot of stuff in early mornings. You may be training in the evenings. On those hot days when we can ensure that the humidity and heat aren't going to be an issue. We're also going to try, my last bullet point here, we're also going to try to group athletes based on conditioning level as best we can, but that will be within teams. We want to prevent cross-contamination, but we know that as we've been tracking athletes over the summer and you've been working with your strength and conditioning coach that's assigned to you. We're trying to track where you are engaged, your conditioning level at this point. So when you do come in, if you're a little bit advanced, you've had access to training equipment over the summer, we can put you in at a little bit higher level than an athlete that hasn't been doing a whole lot over the summer. So be aware of that as we get up and run. And with that, I will turn it back over to Corey.
All right, thanks, Mike. And as you can see on your screen, our next presenter really needs no introduction, but I'll give her one anyways. Kelly Jones, Head Equipment Manager, going into her 34th year here at the Berg. Welcome, Kelly.
Thanks, Corey, and welcome to all those returners, and welcome to all the new student athletes that we'll have on campus. It's great plug for Suki. He's also a member of the Gettysburg College Equipment Room, and the Instagram is gberg Team EQ, since we're doing that. Team Shop for Apparel. Corey had put that in the chat. That's the link if you want to get your weightlifting gloves, foam rollers. We are not using locker rooms at this time until we move into different phases. So be prepared that you will not have a locker room. And as we have talked about, laundry loops and laundry will begin as we go into phase 2 of how we get into this acclimation period. And then we will post hours of operation once we have all the athletic schedules and that have been established. So I'm real short and sweet. If you have anything, any questions, feel free to email me, shout out to me. But I look forward to seeing you all back here next week. And yeah, let's have some fun with this and do your job. Culture change. We need to do it.
Thanks, Kelly. And last but not least, we have Cindy Wright, Director of EES Student Success and Wellbeing. Cindy, another member of our 3-decade club here at Gettysburg. Take it away, Cindy.
Good evening, everyone. It is a true honor to be here tonight and welcome you all to this great Zoom meeting. And we can't wait to see you back here physically. As you can tell from our colleagues' excitement, we are counting the days and we hope you are very excited to get back. The Berg looks a little bit different, but it is still absolutely beautiful. And in fact, right now I'm looking out my window and I can hear the bells chiming and the sun is setting and it's gorgeous. So we can't wait to welcome you back. As my title is, I am the Director of EES Student Success and Wellbeing. So I pay attention to our student success and wellbeing at a very high level. And what that really means is we often think of well-being as just being a physical one-dimensional thing, but we know that well-being is very multi-dimensional. So it's not just physical, there's the mental health, there's the financial health, there's the social health. So a lot of things are working in our athletes' lives, and I'm here to help them if they ever have any struggles. Sometimes coaches will connect me, and sometimes the athletes will also just find me. I can be a great liaison for them, a great resource for them to share with them all the types of programs that we have on our campus that can help them navigate college. The other thing is I'm a member of the care team, and the care team meets twice a month, and we talk about students that are struggling at a higher level, and we will pull together and we have academic advising in the care team, and we'll ask them, are our students going to class? Are they, do they have a friend group? Are they eating well? And we just have more eyes on our students and our student athletes. So besides all of our department and our coaches and our training and everybody involved in this meeting tonight, there are other eyes on your student athletes. The Student Success Advocate Program is a brand new program. We're launching it this year, and I'm really excited about this program. It is just for our first years, but we'll be doing it every year. And there are 15 Student Success Advocates on campus. I'm one of them. And I will get a group of students, around 50 first years. So maybe I have some of you now as my advocate. And I will stay with you for 4 years. And I will make sure that I'm helping you navigate all the challenges that college brings, besides just the academic component of it. And I can also give you great advice for what restaurants to eat at and things like that too. So, and then the last thing I want to talk about is the Student Athlete Wellbeing Program. We launched it last year. It was a pilot and it was really successful. We talked about, we have a new program that we're looking at sleep. We talked about nutrition. We talked about social media. But this year we're going to expand that program and make it even wider. And we're connecting again with career engagement and looking at career competencies, but we're also going to be lifting up diversity and inclusion and having conversations around that, because as you know, that is a very powerful and important topic that we need to address on our college campus and across the nation. So I look forward to welcoming you all back in just a couple of days now. So stay safe and we'll see you soon. You're back to you, Cor.
Thanks, Cindy. So that is our presentation. I'm sure some of you have some questions, and I just received a question about when teams can get in and start seeing the athletic trainers and also get in to do some lifting in Jaeger Center. And Cindy, I know we just talked about this earlier today as to when the facilities will be open. So if you want to take that one.
Yeah, sure. We are not opening till the 24th because our staff that is trained to run the facility, their training was supposed to happen right after spring break. And unfortunately, the campus closed its doors at that time we went online. So our staff has not been trained yet with all the new protocols to get them up and running. So it will take a little bit of time just to have that happen. And then we'll open our doors, of course, to the Jaeger Center. There are the outdoor fields that are available for all of you to get out there and do some running, of course. And you know our battlefields are gorgeous, so don't let that stop you too.
Thanks, Cindy. And as Suki can attest, the stadium stairs are still out of Shirk too. So there's plenty of room to do stadium stairs out there. Suki worked up quite the sweat, running nose, as well as a 40-yard dash. Suki, I won't tell people what your 40 time was, don't worry. So we got a couple pre-submitted questions here, and these were coming from the women's basketball team. So welcome. I think I saw a couple out there. Meredith Brown, I know you're out there. So hello, Coach Davis, I know you're there too. So what will workouts practices look like in the fall semester? And Mike, I know you kind of touched on this. I don't know if there's any more specifics we want to throw out there for this question.
Which Mike? There's three of us.
Mike Hoyt. We'll go with Mike Hoyt. The other Mikes will get the other two questions.
Yeah, so a great question. Basically, what's going to happen is you will have time reserved for strength and conditioning, and that'll be set up. You know, that's kind of the next thing that we're doing here as coaching staff is looking at class schedules and determining when athletes are free based on the sports and getting time reserved to get into these different training spaces, whether it's Hauser or the outdoor spaces or what have you. So that's part of it. And that's basically, you know, the way it's always been. They are, you know, non-mandatory strength and conditioning sessions. But then also your sport coaches will be having time to get sport-specific skill work done, you know, like your normal practices. So, you know, that stuff will be planned as well.
Thanks, Mike. And I have a question for another Mike. We'll go with Cantelli this time. And this is what happens if there is a positive test for COVID amongst a team. If a team member gets a positive test, what are some of the protocols that get put into place at that point?
Popular question over the last few nights. So I'm assuming you're asking once we get back on campus, we're rolling, and then a team member becomes positive. Well, one of the reasons why we're keeping you in those small groups, in nests or pods or bubbles or whatever term you are used to hearing around. So we're keeping you in those small bubbles for a reason. So if one person in that bubble becomes positive, it's only potentially affecting that bubble, right? And not others on the team. So what we do, if somebody tests positive, that person then becomes a case, and then that case has to isolate, right? Either goes to a on-campus room that is designated for positive cases, or they go to a hotel in town that we have rooms at that will hold other positive cases. If you go to those rooms, there's also a case manager from that health center that will be checking in virtually with you all the time. You'll have your food delivered. You'll still be able to go to classes virtually. So all that will still occur, and we'll be checking on you. We may say, hey, going home is a great option too, if that's available to you guys, if you're close. So that may be an option. But then what happens with the rest of the team or the people that are in your bubble, right? So you may have heard the term contact tracing. So that will kick in. Somebody either from the athletic training department or the health center will start asking the person that becomes positive, who have they had close contact with either 2 days before your symptoms started or 2 days before a random test, okay? So that's when we're finding that when the virus can spread. So we give those, you give those names, and then we would contact those people that you've had close contact with and say, hey, potentially you may have come in contact with someone that's positive. No names are given. We don't tell who the positive case was, but we just tell you that you may have become contact, and we ask you to self-quarantine for those 14 days. So what constitutes a close contact? So if you are, what CDC is saying, if you are within 6 feet of somebody for 15 minutes or more, that constitutes a close contact. Or you've had direct contact with them either through things like kissing, sharing tissues, towels, sheets, anything like that. That's again why we say that we have to stay within our own self. We don't share. We limit our contacts with other people. So that is very crucial. We wash our hands, we wear our masks, we physical distancing so that we don't fall into any of those categories and have to self-quarantine a large number of people. I hope that answered your question.
Thank you, Mike. And got another question come from women's basketball. And this one I think is for Mike Mattia. What decisions about the winter sports season have already been made, if any at all?
So there aren't any decisions that have been made. We're, as I mentioned in the beginning of the presentation, we're still in that we're going to be evaluating throughout the month of September, and then we'll be able to decide where we're going to go with the winter sports, and ultimately the Centennial Conference presidents will make that decision. And as all of us has been saying, it's going to be all the factors on our campus and the factors on all the other campuses and what's going on in our communities, the region, and in the country that ultimately will dictate our ability to get started up again.
Thank you, Mike. I had a question come through the chat room as well. Kelly might be able to answer this one. Is there any phase associated with when the locker rooms would open again? And I'm surprised that wasn't asked at any of our previous town halls as well. It's a great question.
I'd probably get some assistance from Mike Mattia, but I think it would have to do when we can physical distance the amount of people in the locker room that's needed. So there really is no time on that. I mean, depending on the size of the team and how far we could spread somebody out.
Yeah, I agree with Kelly, and as factors progress in a positive way and we're able to get into phases 3 and 4 is when I more envision us opening up the locker room space, and to be determined on any mitigating factors that may have to go into that when we do open them as well.
I feel like that question in itself might be a little sport specific too, because the size of the teams range so drastically from one to the next. So question for Mike Hoyt. So no non-traditional, traditional seasons. That doesn't really impact winter sports very much actually, but there's still that question of prioritizing the spaces, the workout spaces. How are we going to manage that between the fall, winter, and spring seasons, kind of having, a mesh of traditional, non-traditional this year?
Yeah, good question. I feel really confident. We've got a lot more training spaces now that we can utilize. So having more spaces at our disposal and them being athlete-only spaces now, I feel real confident that we'll be able to get, our fall athletes, our winter athletes, and our spring athletes enough access to these spaces that we'll be able to, get done what we need to in terms of getting athletes in there as much as they need to during the week. so that they can progress with their strength and their conditioning and all the things they need to do. So, I envision us having, being an athlete only. We can start early in the morning and keep rolling all the way through the day. I mean, we can have it open 14, 15 hours a day. That provides a lot of opportunities to get teams in there. Obviously we got to work around class schedules and things like that. But I feel confident we'll be able to get a lot of work done with a lot of athletes.
Mike, just sign me up when you want to do some demonstrations with the tire flipping. I'm
We get
with you right there. So, Mike Cantelli, one question you kind of alluded to earlier. Obviously, we started testing today. You mentioned Suki getting his COVID test today. How is the college guaranteeing a 48-hour turnaround when, we've heard out there that some hospitals are taking 10 to 14 days with some of the test results?
Thanks, Corey. Well, we've been fortunate to investigate and come and have an agreement with a lab that is only taking on a certain number of schools, really just us and another institution and a couple nursing homes. So they are very narrow, and all they're doing is COVID testing. So I think some of those in the media that you're hearing about are larger labs that are taking on many, many different institutions, colleges, nursing homes, companies, on top of their normal testing of blood work and everything else that goes into those labs. So, through a lot of research and going through a lot of investigating and interviewing lots of places and hearing pitches from a lot of places, we feel confident that we are able, or they're going to be able to get those results back to us within that time frame. We'll know very shortly. First ones went out at 4 o'clock today. So hopefully we're getting those back, either tomorrow evening or the next day. I'm losing track of my days, what today is, but hopefully by Friday morning at the latest, we're getting those back. And, I'll be able to tell you more once those come back, but we feel confident that it's going to happen, and they tell us they can make that turnaround. I think we're really the only customer going on, since we're starting a little bit earlier than others. I think we're the only customer they have right at this present time. So we're confident.
Thanks, Mike. Got a couple questions coming through the chat. The first one, is the pool going to be open to everyone or just swim athletes? And this is a second part about potentially having virtual swim meets with conference competition. There is actually a precedent for that within the Centennial Conference a few years ago. I believe Dickinson and Bryn Mawr had a virtual meet too. So, Cindy, pool going to be open to everyone?
It is. We are planning to have the pool open. We have 13 lanes that we're offering for reservation system for the general community to get in, their swimming in. And then Greg also has plans, I believe, and I'll let him answer for the athlete side. Or Mike, Mattia.
Yeah, I'll take that and follow up with the second half of that question. As we mentioned, your sport specific meetings will be coming up, and you'll know what based off of class schedules, what athletes will be able to and when you'll be able to start accessing the pool. But yes, that will be open starting the same time that the Jager Center will be open as well. So all you need to do is get your medical clearance and figure out with your coach exactly when those groups will start getting in the pool. In terms of virtual meets, I can tell you that all options are on the table right now for the Centennial Conference and what we want to do and how we can try to provide the best experience and get some competitions going. I know this is something that the Centennial swim coaches have presented to us, and as we progress forward with those decisions about what we're going to do with the winter sports, that is certainly going to be on the table and is a great suggestion.
Thank you, Mike. And Cindy, you got another question in the chat. This one comes from Jack Edelson, of course, the gold medalist in the 100 and 200 fly this year in the Centennial Conference Championship. Jack, I'm surprised you didn't ask me if I'd be interested in doing the Kinzoo Adventure Race next summer, but we'll go with this question instead. Will the general student population be able to use the equipment in the field house? Mike Hoyt, I think this is yours.
Yes, it's going to be reserved for athletes only. We want to make sure, and you've heard us talk about making sure that we're in our little pods and we're in our groups. So we don't want, cross contamination. We don't want to expose different groups to, possible contamination of the virus. So we are going to make that an athlete only facility.
I think in terms of us, you'll notice in the Jaeger Center, the traditional Hortensio fitness room, there's going to be a lot of spread out equipment. And then obviously in the Hauser, what this does, it benefits the athletes. We haven't had a dedicated athlete only space for a while. So that it gives us, from a timing perspective, a spread out perspective, but it also then benefits the rest of the student population as well, because it allows them more time to be able to access the Jaeger Center and get their workouts in, and we can still spread out and everybody can get to their equipment and get what they need. So for this part, I think it benefits all of campus and our ability to do that.
Another question from the chat room, this one from wrestling senior Sean Thompson. Hey Sean, how are you? For wrestling, will there be more dual meets rather than tournaments this season?
That is yet to be determined as we move forward and figure out our ability to provide competitions. I know there are, each sport, as I mentioned with the swim coaches, the coaches associations are looking at scheduling based off of the criteria that we would provide. So again, all options are on the table. We will pursue everything, and whatever we can get in a safe and healthy manner and provide a great competition, we will certainly look into.
Oh, just had a reminder about a question that Mike Cantelli actually brought up earlier in a text about, games for basketball, and obviously the wrestling team works out in the wrestling room too. How are we approaching those types of events?
I'll take that. We are going to discourage any pickup games for basketball and wrestlers getting up in the wrestling room and doing your own thing up there. We're trying to, again, encourage just these small pods and working out with Coach Hoyt and your equipment, strength and conditioning people. So please after that, don't go into the gym, into the field house and do pickup games, basketball players. I know, let's really concentrate on that early on so that we have the opportunity to do that later. So that's going to kind of be your non-traditional on your own phase. So we're going to ask you not to do that stuff until we get rolling and see where we are. And then we'll work with our coaching staff to see how things can progress and hopefully get to that point. But when we first come back for a while, please do not do that. And wrestlers, please stay out of the room on your own. I don't know if Mike wants to say anything more on that. Mike.
You right on the head.
I agree.
So yeah, one more question. This is a great question too, because this really impacts the winter athletes. Now the fall semester obviously is only going up until Thanksgiving, with students being physically on campus, and then the second semester is picked up on January 11th. Now typically some of our winter athletes have stayed over during winter break. So what are we looking at in that regard for them being able to come back and train? Obviously we don't have schedules set at this point in time.
Yeah, a lot of that will be determined upon the schedule, right? If we're set a schedule and it becomes official and we're starting up winter sports, then, based in and baked into that schedule will be our approval to want to come back and do what we need to do to prepare to start the season or pick up the season, depending on how it comes. So, our ability to get the season started will determine whether or not we're able to come back during that break period.
Another question through the chat coming from Mr. Thompson. Since many schools may cancel sports, are coaches looking to other schools that we don't usually compete against to get matches or games. And Mike, I think you said it earlier. I mean, everything is on the table at this point.
Yeah, I can say that throughout this process, competition amongst Centennial Conference schools has been primary. However, as things have progressed, we will flexibility, more and more flexibility has been provided to us, not only from the NCAA, but in our discussions in the Centennial Conference, as to being able to look at it more as a individual institution perspective than as an entire Centennial Conference. So again, everything's on the table, and we will be pursuing all possible options.
Thank you, Mike. There's no more questions sent in the chat room. I'll give people another minute if they want to ask anything. In the meantime, this presentation has been recorded. It will be uploaded on our YouTube channel, Gettysburg Athletics, later tonight. It'll also be accessible on our COVID resource page. I updated that page with quite a bit of information today concerning campus recreation, the Jaeger Center, the equipment room, athletic training, and strength and conditioning. So please go to that webpage. It is gettysburgsports.com COVID facts. Check out the information that's there. It contains everything that was in this presentation at a higher level. So there's a little bit more detail there, including the phased in, the sanitation protocols, and everything in between. We'll also be working on some more videos in the coming weeks as well, trying to show you all how things are going to be a little different in our area. So I don't see any more questions. So I think we answered everything. So I want to thank our 5 presenters today. You did a great job. I hope everyone had their questions answered as best as we could. Oh, wait, Mike Idice swooping in at the last second with a question here. If the weight room in the field house is not being used for a group workout, can athletes also jump in and use it? And I think this gets to the scheduling of that area, Mike Hoyt, if I'm not mistaken.
You're correct. What we want to do is make sure we're scheduling the times for it to be used, and that way, because the biggest part of it is cleanliness and sanitation, but then also the tracing of it, so we know who's in there at what times. So if we do have a positive test, we can trace that and figure all that stuff out. So that's how we're proceeding with that.
Yeah, I mean, we're still working through some things, of course, with everything. We're all kind of in this new world together and going through everything day by day. New information comes out every single minute of every hour, it seems like. Well, I think that's a good ending to this conversation. So I want to thank everybody for tuning in. It was great just seeing some familiar names out there in the chat room and in the participant list for the 5 presenters, the 3 Mikes, Kelly and Cindy. Can't wait to see all of you. And please stay well.